She was admitted yesterday. Yesterday, she came to the hospital. She was busy. Yeah, resuscitated, admitted, and she passed away during her sleep.
Right.
Okay. We get to give you a couple of minutes to prepare. And for the time being, we will discuss how the paper should look like. I'm working my way out through this. So, to start with, you will get your own paper and 5 minutes before the case or before meeting your surrogates. So we need to organize the paper properly. So we will start by writing down the name and the age of the patient. And then I will write down my task. What did I come to do here today? Then items of the history that I take in any communication station as long as the patient is alive. Again, as long as he's alive, it's mandatory to take social history, past history. Dr. Suraba, you have a lot of background issue noise. If you can use your headphones, it would be great. Social history, past history, and medication history, with or without a family history. And this is generally speaking regarding any case in station 4. It is mentioned in station 4 that you should not take history, but we fucking take it because this includes only clinical history, but social past medication is mandatory in every single case. Then moving on, we have the approach. The lower third of my paper, I have an approach. Approach for all communication is very simple. There is a proper introduction, and the introduction is 6 points, no paragraphs, only points. And there is, at the very end, there is a closure, and the closure is essentially 7 points, again, if the patient is still alive. In between, we have the stem. The stem of the case will depend on the topic in hand. You can find the steps for the introduction and the closure, both in the PDF on the Telegram group, and the link for the Telegram is shared already in the chats. Quite easy, quite straightforward. So that's how to organize the paper. One more point before we start, and this is a very, very important point. In any scenario, most likely you will be the senior house officer, but this is not the fact. You will be working as a doorman. A doorman is simply someone working in the department, closing doors, working for the guy who owns the building, the owner of the building, who happens to be the consultant in the scenario, who happens to be your examiner, because your examiner is a consultant. So as a good doorman, I will stick to my rule by not giving any promises, no time frames, not today, not tomorrow, not whatsoever. I will stay away from mentioning yes or no as much as I can unless I am very sure about it. And as a good doorman, I'm not offering any investigations or treatments unless decided by the consultants, except in cases where there is only one kind of management. Only then I will discuss the management plan, even if it's not mentioned in the scenario. That would be the general outline of station 4. I'm keeping in mind that some of you are preparing, and this is the first preparation for them, so I'm trying to keep things very easy. Back to our case, we have a 58 years old lady. She was admitted with hypoadrenalism. She was resuscitated. Then she was admitted. And CT abdomen has revealed that she has a mass on her right suprarenal gland. The consultant believes this is most likely a cancer for further follow-up. So it's not confirmed for follow-up. Unfortunately, she passed away. This is the summary of the scenario. She passed away during her sleep, and to make it even more clear, in the ward while she was admitted. And the consultant did ask you, since he's keen or he's interested, let's put it this way, the consultant is interested to know the nature of the growth. So he did ask you, as his senior house officer, to take a permission from the next of kin her granddaughter, Miss Stewart, for a post-mortem hospital examination. That would be the summary of the case, and thank you for Dr. Asma, who wrote down the scenario. It's hypoadrenalism. Back to you, my friend. If you are ready, let's have some fun.
Ready, sir.
Okay, let me set the timer, and the timer is on. The mic is yours, and go.
Hello, Miss Stewart.
Hello.
Hello, I am.
Yep.
Hello, I am Dr. Saurabh Gaba. I am the SHO on the ward.
Senior House Officer. Yeah. Nice to meet you, Doc.
May I please confirm that you are Mrs. Stewart's granddaughter who was admitted yesterday after having a collapse?
Yes.
Yes. So, Miss Stewart, we are all really sorry for your loss.
Thank you. If you can have your mic on or your headphones on, it will be great, Dr. Suraba.
Right. Right, sir. Okay. So, Miss Stewart,
Yes, sir.
I've come to talk to you regarding your grandmother right now. Would you be comfortable talking to me right now?
Yes.
And do you have any friends or relatives with you in the hospital today that you might want to join in with your discussion?
No.
Right. Okay. So, we have to decide where we take things from here now. And since Mrs. Stewart has passed, there's nothing that can be done now. But we spoke to our consultant and he wanted to raise an important issue with you.
What is it?
Yeah, before I jump into it, may I please ask how much you have been told so far about your grandmother?
Well, what I have been told so far, that after her admission, they told me that there is something wrong with one of her chemicals, one called hormone, and they are going to investigate it. Then I went back home to look after my kids, and when I came back in the morning, I found out that she has passed away during her sleep.
Yes, indeed. That's what we found her from her tests, the blood tests that we did. And when she came in, we started giving her the essential treatment.
Yes. I made sure that her
And,
condition is stable before going home.
yes, that's right. We are all really surprised by what has happened. We did a CT scan yesterday, and
An imaging.
we found, we did a scan of her tummy yesterday, in which we found something suspicious inside her tummy.
Suspicious? What do you mean?
Yeah, there was a mass, there was something which should not normally be there.
Oh.
Yeah.
What kind of a mass?
Well, it looks like cancer, but we are not 100% sure.
Okay.
So that's what I've come to talk to you about. Since we do not know for certain what it was and which might be related to her death, the consultant is contemplating a post-mortem examination. Do you know what it is?
No, what is that?
Okay, so after a patient has passed away, we can open up their body and take out the structures inside the body and examine them. So it helps us. Yeah. So it helps us find out what exactly was going on inside her body. It can help us arrive at the diagnosis.
Doctor, but she has already passed away. What would be the benefit of doing that test?
Yes, I understand what you mean by that. yeah, nothing can be done with regards to that right now. But this is the way in which the medical science progresses. And this is the way in which we doctors learn and increase our knowledge, and we are able to help our patients in future. So, if we get to know what exactly was wrong with your mother after the post-mortem examination, this would be really useful in the future for us and also for other doctors whom we share our experience with.
What kind of
Are
a
you
test is
getting
that?
me?
How do you perform this test?
Yeah, so that involves uh, putting an incision or a cut over the body, and this cuts might be at many places, but in your mother's case, we are mostly interested in your tummy. So after putting a cut in the center of her tummy, we will take out that mass which we saw on the CT scan, and that mass would be sent to special doctors who would look at it under a microscope, and
Mhm.
that will help us know exactly what it is.
And after having this test done, would you be sure 100% what was the cause of the problem?
Well, I'm afraid there is no guarantee of it, but there is a very high probability that we would know what was wrong.
Well, doctor, you told me that there would be a cut in her body, an incision, and I'm afraid that this will disfigure her body.
Well, in a way that is true, but the cut is very small. It's in the center of the tummy, and
Are you sure it's small?
right. So I'll speak to my consultant whether we want to take out only that mass or any other structure also, because the size of the incision would depend on that. I'll check with my consultant and get back to you with this one.
I do not wish to have any delay when it
Right,
comes to the
right,
funeral.
right,
I already did contact the family in order to prepare for the funeral.
right. So this generally doesn't take a lot of time. It can be done within a day or two, and
Day or two,
we
do
can.
I hear a time frame?
Right. So I'll speak to my consultant, and we will expedite the process and make sure that it happens as early as possible. However, I won't be able to commit to a time frame right now. So I'll just get back to my consultant and the doctors who are going to perform the postmortem, and I'll get back to you with that.
Who will do the test?
So these are other doctors who are called pathologists. They are trained in this postmortem examination.
And where will you do it?
It would be done in a hospital only. There's a special department for that.
Okay, but doctor, you told me that you will be taking something out of the body, the mass. I'm afraid that they will take
Yeah.
organs as well. I do not want anyone to take any organs from my grandmother's body.
Right. So before we do that, we will explain to you everything, whatever we plan to do. And when we take out the organs, after we have examined them, we will get back to you. Either we can dispose them off in a respectful way, or if you do not wish to allow us to retain them, or if you allow us, then we can retain it and use it for future study purposes. That will only depend on what you want, and we will abide by it.
Doctor, but I will not be able to attend this kind of a test. How would be I should be so sure that you are going to comply with whatever you say?
Right, right, right. I understand your concerns.
You understand?
So
You will never understand.
I appreciate your concerns,
Thank you.
Ms. Stewart. So there are strict rules in place for this. We have certain laws which determine how this procedure is carried out, and we have a team overlooking the whole procedure.
Okay.
Yes. So would you like to ask me something more, or should I go on?
Carry on, please.
Yeah. So as I was telling you, after we put an incision, later on we close that incision. and it is concealed under the clothes, so it won't disfigure the body.
Thank
That
you.
won't be visible. So, what are your thoughts about all this?
Well, I'm not so sure about it. I need some time to think about it. For the time being, I would need the death certificate, please, in order to carry out the rest of the funeral procedures.
Okay, okay. So, we don't need a decision right now. You can take some time and speak to your friends and relatives about it. And regarding the death certificate, do you want it right now, or would you like
Yes,
to
please. I
have
want it as soon as I can in order to proceed with the funeral.
so okay, so it means that you are not willing for the examination, I suppose.
Does it have anything to do with the examination?
Yeah, first the death certificate would be issued to you after the examination, because in that we would be able to mention the exact cause of death, hopefully.
What if I refuse the test?
Right, right. So, well, ma'am, that is absolutely your wish. We know that this is a difficult time for you, but I told you the reasons for which we are contemplating doing this post-mortem examination. But it is absolutely right to refuse it.
So if I refuse, will you give me the certificate? You have 2 minutes
Yes, that
remaining.
would be done. Yes, ma'am, that would be done. The certificate would be issued to you.
Thank you. 2 minutes remaining.
So, would you like to ask me anything?
Do you have any further concerns? Use concerns, please.
Right. So, do you have some more concerns?
No.
Okay. So, I would arrange a meeting with the consultant in some time, and you can think about it, and then we will take things from there. If you do not wish to get it done, we will give you the death certificate, and you can go on with the procedures for the funeral.
Thank you.
Right. So, thank you, Ms. Stewart.
Okay.
Okay, I'm done, sir.
Okay. So let's agree first that you have done very well, my friends. However, there are some points here and there that we need to tackle in order to make it perfect. But overall, very well done. Thank you for trying, and this is the best way to learn something. But now it's time for me to eat you alive. So on the screen, we can see the points that we have for the discussion. These are my concerns usually in such a case. Let's get back to you and start with the standard type of questions. One, what is the medical issue in your scenario?
Right. So, that is the post-mortem examination.
Let's be organized, since this is the first question with your examiner and you want to give the best impression. So start always with the number. The number is usually the age of the patient. This is a 58 years old lady. Then you will tell me the story of this 58 years old lady. Agree?
Right, sir.
Agree. What are the legal issues in your scenario?
Okay.
What are the legal ones?
Firstly, autonomy. Okay,
Legal.
Okay, okay, okay. Consent.
Consent for what?
Okay, I should have asked. Oh, no, no, sir, I'm not sure. I want to learn.
You are right. You should have discussed the consent with me, but you did not.
Right.
So far we have only two legal issues here, which are the death certificate and the consent, and we can add the post-mortem examination being a part of a legal process. That's fine. What are the ethical issues in this scenario?
Okay. So one would be autonomy, and I should have asked, had the patient ever? Oh no, sorry. Autonomy of the next of kin.
Do you think it applies in this scenario? Okay, so let's agree on the principles. Medical issue tackled, checked. Legal issues, checked, and we will come to that later on. The ethical issues, whenever it comes to any ethical issue in whatever scenario, we need to mention the standard answer. The standard answer for any of them is just the term and the definition. Keep it very simple. Does it apply in your case? Yes, it does apply in every single case in communication. The same ethics throughout every single case, whatever the topic is. So autonomy, this is the patient's right. And remember that we hate paragraphs. We will make it just in points. That the patients or the next of kin in this case would have the right to know everything about the clinical condition, the management plan or the procedure you're going to do, and he or she has the right to accept it or refuse it. This is the autonomy. Beneficence, we are doing this in order to be or to have something good out of it. There is a benefit out of it. And avoiding malfeasance, we are not causing any harm to the patient. She has already passed away, and we are not going to cause any harm even after she has passed away. And justice in two simple phrases, it is all the same and regardless. This is how I keep it simple. Every term is just a simple word or two. So all the patients or all people get the same kind of treatment regardless of their age, color, sex, or religion. This is the standard simple answer for whatever ethical issue you may encounter. Standard 4 plus a fifth one only in case of a medical error, which is, can you guess?
Candor.
Duty of candor. This is only in a case of a medical error. Other than that, all the same for all the cases. So those are the standard type of questions. Let's get back to your case. If I want to put a proper approach for this case, I will start by proper introduction. Again, the introduction and the closure are the same for whatever case in station 4, as long as the patient is alive. And those are 6 steps. You can find them in the PDF on Telegram. So the 6 steps are, like you have done, is to greet the patient first, introduce yourself, confirm the patient's identity, confirm the agenda of the meeting, and take a permission to discuss it. How much, or do you want anyone to attend the meeting if applicable? How much do you know about the condition? And the most important one here would be expectations. This is the one that usually everybody forgets for some unknown reason. So, hello, I'm Dr. Hassan. I'm the senior house officer in the endocrinology department. Don't use the glands, just endocrinology departments. May I confirm that you're Mrs. Stewart and the granddaughter of Miss Stewart? Yes, I am. We are here today to discuss the clinical condition or the condition of your grandmother. Would that be all right? Yes. Would you like anyone to attend the meeting with us? No. How much do you know about the condition so far? Let her elaborate. She will tell you everything she knows about the condition. You have assumed that she already knew about that she has passed away. Maybe she doesn't. Maybe she does. So we will give her time to elaborate. Then, do you have any expectations? And I will keep this as an open-ended question. Expectations regarding the condition, regarding the meeting, regarding whatever. Do you have any expectations? Yes or no? Let her. And usually the expectations are your key to the next step. So this is, simply speaking, the proper introduction, which is a very essential part. Are you following?
Yes, sir.
Okay, so we did identify that. Then this lady already knows about her mother's condition or grandmother's condition, so there is no breaking bad news. She already knows, but we need to show a lot of sympathy here. So I would consistently or continuously tell her that we are sorry for your loss. I can only imagine how bad this is for you, and blah, 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 blah. This is the second step. Then comes, why are we here? We are here today to discuss the test or the post-mortem examination. Like any other examination or test to be done in station 4, we have certain steps. The first one is, why do we need it? Secondly, what if not done? Then the test itself or the technique itself. Who will do it? Before, during, after, if applicable. And let's remember that this is generally speaking for whatever kind of a test, whether this is an nephrostomy, whether this is a renal biopsy, liver biopsy, CSF, whatever. Then comes the possible complications. Then comes alarming signs, if applicable. Here it's not, of course, because she has passed away. And lastly, we have the consent. And if you want to be even more professional, let's get a verbal feedback. Let's put it this way, a verbal feedback. This is for whatever kind of test that you have. Then comes the point of the closure. So if you take a closer look, you can see that we have an introduction, we have a closure, and in between, there is the stem, like we have mentioned in the very beginning. Simple steps to be carried out here and there. Following?
Yes, sir.
Following. That's an easy one. So if we want to tackle the steps one by one, what kind of a test is that? The test itself. The test itself includes a clean incision. Let's put it this way because it's helpful. Clean incision without mentioning the size. In her body without specifying which part of the body, in order to take a closer look at her organs and the mass. So it's the organs and the mass, which will be closed properly. It will be hidden by her clothes after the test. It will not be visible to anyone. So what kind of test is that? It includes a clean incision that would be made to her body in order to take closer look at her body. Then it will be closed properly and it will be hidden under her clothes, not visible to anyone later on. We may need to take a snip or a slip or whatever you want to mention in order to be examined under the microscope by a special type of doctor called histopathologist. So we may need to take a sample, a small sample, snip or slip, to be examined under the microscope. That's the test. Easy?
Yes.
Following, perfect. Then the test itself, why do we need it? What is the benefit of this test? What do you think the benefit is? One, it will help us determine the exact cause of death. What is the value of having that? What do you think? Why it's important? Hello? Keep up with me, man.
I'm not sure, sir. I'm not sure.
Can I call you Dr. S, please?
Yes, sure.
Yeah, sure. So, Dr. S, in order to get the cause of death, which will bring relief to the family. Simple.
Okay, right.
And this will help us prevent, and this is one of very important points, prevent this from happening again to other patients with a similar condition. And it will help also in any future research and study. So the benefits, simply speaking, 3 points. Let's stay away from paragraphs. Can you tell me what are the benefits of the test? She has already passed away, Dr. S.
Yes. So knowing the exact cause of death would bring relief to the family, and the knowledge could be applied to other patients and prevent their death, and it can be used in future research.
Thank you. And when it comes to this part, since we love pitfalls, I will post a funny video, I'm sure that most of you have seen it before, equals خوازيق. And this is something painful that causes a lot of loss of marks in the exam. You do not want it in the exam. So in order to dodge the pitfalls or the خوازيق, do not mention the possibility of having a familial disease. or a familial cancer or whatsoever. If you do that, because some people will tell you to do it, to prevent this from other family members from suffering the same problem or compromising their lives. This is fatal. Can you hear me? I hope
Yes,
that
sir.
my voice is clear. Okay.
Yes, sir. Yes.
So no familial diseases or familial predisposition, or whatever that is, because this is fatal. You will hear a lot of drama and there is no confirmation about the diagnosis even yet. Moving on, then what about the disfigurements of the body? You have given me the right answer, but the problem with your answers throughout is that you do not show sympathy. And Dr. S, you did not change your tone of voice. You were using the same tone of voice throughout, and this is not what you want to do in the exam. This is how the examiners judge that you are showing sympathy. So I am sorry regarding your loss again. There will be no disfigurements. Clear message. It will be a clean cut or a clean incision. It will be closed properly. Let's put it this way. It will be closed properly, and it will be covered by hair closes, remaining invisible to everyone during the funeral. The same things that we have said earlier. Easy?
Very easy.
Easy. Then comes the delay in the funeral. Again, simple, clear message. There will be no delay in the funeral. When will you do the test? Since I do not mention any time frames, I will refer it to as soon as possible. How much time does it take? It depends on the tests, but we will try to do it as soon as we can. Make sense?
Yes.
Then I am worried about you stealing hair organs. I am not going to be there when you do the test. And by the way, this has happened more than once, maybe twice or thrice, and it was a scandal for the NHS because some hospitals did keep parts of dead babies. It was called Bristol baby something. And they kept the organs without the consent of the parents. So she has some right to question your integrity, since there are people who did bad things in the past. So the proper answer for that is, as usual, is appreciation. I am really sorry for your death. I can only imagine how difficult this situation is for you. Whatever you want to mention as a part of the sympathy or the appreciation, then you will tell her that you are a professional team with high standards. And you, as a team, will submit an official report regarding the outcome of the tests. And the lady or the next of kin or the family has the right to know what was in the test or to get to read the report. So we are transparent. We will make it official. It means that we are liable to legal actions if we did something wrong, and you will have access to it as well. So we are not hiding anything. Plus, you will always have the right to see your grandmother after the test. Following? Dr. S?
Following, sir.
So how would I be sure that you are not going to steal any of my mother's or grandmother's organ, Dr. S?
We are a professional team, and we are a professional team with
This is not the first point. What is the first point?
Okay, I appreciate your concern.
Okay.
But let me tell you that we are a professional team with very high standards. We are going
Mm-hmm.
to prepare an official report, and
Mm-hmm.
you would know all of the contents of it. And moreover, after the post-mortem, you would get to see your grandmother, and you can see for yourself.
Thank you. So it should be an easy one. So back to the approach, we have an introduction. We have the test itself. The test, why needed? What if not done, we will not reach the exact cause. Who will do it? A professional team in the hospital, in an operation like room, or in a room, clean room, same like the operation room. And they will do the test, blah, 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 the same details that we have mentioned. Then here, the complications are usually the delay, the organ stealing, and the disfigurement. And then comes the point of the consent. Do you think that this lady needs to write down a consent or to sign a consent before having the test done?
Yes.
Definitely yes. And this is going to be a critical one in the discussion with the examiner. Never forget it. What are the criteria for any consent, Dr. S?
Yeah. So the patient should be competent,
Okay,
informed, and
okay.
consent should be voluntary.
Come again?
Competent, informed, and voluntary.
And volunteering, anything else?
No payment should have been made for example, for your organ donation, etc.
Okay, and how would you say that to the examiner or in front of the examiner to the patient to get the full mark without any discussion with the examiner? Can you interpret that into a discussion under 30 seconds for the full mark?
Oh, okay.
So before
Okay.
having,
All right.
let's do this together. Before having the test done, we will need you to sign a consent. Consent is not jargon, it's English. And it's not a paper. It's not a yellow paper or a newspaper or whatever, toilet paper or whatever. So we will need you to sign a consent. This consent will contain all the information that you need to know about the test, all the info. Take your time and read it. And please sign it when you feel ready. You have the right to withdraw it anytime before the procedure. So by mentioning that, let's match it. So it will contain all the information. It is well informed. She will take her time to read it, to understand it. It means that she's competent. And sign it whenever you feel ready. This is giving her the freedom to accept or refuse. This is being a volunteer. And the last one is going to be the continuity. She has the right to withdraw it anytime before the procedure. So you have now less than 30 seconds to take the full mark in clinical judgment and to tell me about the consent, please.
So I'll get back to you with the consent form, which will have all the written information about this procedure.
Before
Take
the
your
test,
time and
let's make it clear. Before the test.
right. So before the post-mortem, I will get back to you with a consent form, which would have all the written information about it.
Mm-hmm.
Take your time to read it and sign it when you are ready.
Mm-hmm. And the last one is that you have the right to withdraw it anytime before the
Right.
procedure. Very simple. Just to know what you're going to say and put it in the proper way. So that's a well done regarding the consent. Then comes at the very end the closure. The closure for any case, we did mention it is 7 steps. And again, I'm usually discussing the general approach, not per a single case. I don't give a shit about a single case. I don't care about a single diagnosis. I want the structure. So any closure, I always start with the concern. Then I go to summarize my case. Then I'm going for concern one more time. Then I'm going to check the understanding. Then one more time, concern. Then I will offer help. Then again, concern. So Dr. S, If you take a look at the screen, how many times did we mention the word concern in front of the examiner?
Many
4
times.
times.
Okay.
If he's asleep during the first one, he will hear the second. If he's asleep during the second and his wife kicked his ass at home
Okay.
before the exam, he will hear the third.
Okay.
So this is to
Right.
make sure that the concern is covered, and this is one of the most common problems in the feedbacks. And more importantly, we are not going to move from the first step to the second unless the gentleman or the lady, the surrogate, says no further concerns. Because this is a common problem in the exam, believe it or not. Sounds very simple, but it happens. And I have failed the exam too many times, and I know why. So I'm not moving from the concern. Do you have any further concerns? Only when she says no, I will move to the summary. Do I need to summarize this case? Yes, I do. Do I need to ask about the second or the third, number 2 concern? Yes, I do. So do you have any further concerns? No. Let me summarize the case to you. And the usual problem here is that people taking too much of a time when it comes to that. Please do it under 20 seconds if you can. Just the headlines. That unfortunately your mom or your grandmother has passed away yesterday, and we want to know the exact nature of this mass, and we will need the post-mortem test that we have discussed. And there is a consent that you will need to sign before having the test done. Any further concerns? No. Would you like to check her understanding? What do you think?
No, because this is bad news.
No, sir. Yes, you need to check her understanding. This is a discussion about the test, not about breaking bad news that she has passed away. Usually, generally speaking, we do not want someone who has lost someone has passed away, we do not want him to repeat the tragedy. But here we are discussing the test, and she already knows that her grandmother has passed away. Do you agree?
Okay. I agree.
Agree. Then comes concern one more time. Do you have any further concerns? No. Then offering help. Generally speaking, it is websites, brochures, leaflets to read more about the condition along with your hospital's contact number, not your personal number. But since the lady has passed away here, we will not use any websites, brochures, or leaflets. You will just give her the number if she has any questions and offer her a ride if she needs a ride home. Any further concerns? No, thank you. Sorry again for your loss. Easy?
Easy.
So what did we do so far? We fixed 1 point for you. This is personally speaking regarding your case. Introduction, we did cover a point or two that you have missed in the introduction. STEM, we did cover the STEM properly with the proper concerns, and we did fix your closure because your closure was not complete. However, it was okay, but still not complete. Now we know how to answer any of those concerns. So overall, that's a good one. But there is still a little bit of a points here and there to discuss, and this is the usual discussion with the examiner. Dr. S, what are the types of post-mortem examination?
Yeah, the coroner's postmortem and the hospital postmortem.
Thank you. And what is the difference between both?
Coroner's postmortem involves it's a legal issue. So, for example, any medical legal case,
Let's
roadside
put it
accident.
as this way. There are certain indications to refer a case
Right.
to the coroner. And I'm translating the word in Arabic next to the coroner or coroner if someone wants to know. So there are certain indications for the coroner, and the usual indication for hospital postmortem is the wish of the team to know more about the case. Easy?
Easy.
Coroner is a legal issue. So as a coroner, it's a mandatory or it's a must to be done. There is no option. The next of kin cannot refuse. It's not his decision. On the other hand, when it comes to the hospital postmortem, it is optional. He can say yes or no. Agree?
Agree.
Agree? And since this is a must, the coroner is a must, there is no need for a consent. It will be done whether he likes it or not. This is the law. But when it comes to the hospital, we need a consent. Otherwise, we will go to prison. And for the coroner, it will be done in the coroner's place or office. So it will be done in their place or in their office. And they are the ones who are going to give the certificate afterwards. In a hospital post-mortem, usually it is carried out in the same hospital. And the next of kin will get the certificate from us. We will give him the certificate as a team. And he will take it as soon as possible, not related to the test. Whether he agrees or not, he will take it because it's optional. And since he's worried about the delay in the funeral, I will make sure that we will prepare the certificates for you as soon as we can, along with the test to be done as soon as possible to avoid any delay. Easy?
Sir, one question.
Yep.
If the hospital postmortem is being conducted, then certificate would be issued only after the postmortem, right?
No. What if she refuses? If she refuses, you do not have a clear diagnosis to put on the certificate as regards the nature of the tumor. But you know the reason of death, which is the cardiovascular collapse. Correct?
Right.
So those are the differences between both of them very simply. The remaining question is usually what are the indications for a post-mortem examination? Coroner post-mortem examination. Can you guess?
Accident.
Let's make sure that we have it in points.
Okay.
Because we hate paragraphs. No paragraphs. So the first one is someone who has passed away during surgery or a procedure or within 24 hours of recovery. Not from hospital admission. General misconcept. Someone who has passed away during a surgery, a heart surgery, and he passed away. This is coroner automatically. Or he passed well through the surgery and in his hospital post-surgical recovery, he passed away within 24 hours. The second one is, shoot.
Accidents.
Okay, but there are two more that we need to discuss beforehand. If
Poison.
Death in prison.
The cause of death is not sudden death, the cause is not known.
So let's put it this way: sudden, unexpected, sudden, unexpected, and unexplained cause of death. We need to put it this way because it makes a lot of sense. Without it, 3 of them, 3 points. Or no attending doctor with the deceased during his last illness. If a family comes to you and they tell you that our grandfather has been suffering for the past 1 week, did you call a doctor for him? No, we did not. This is suspicious. Coroner. Another example, if the deceased or the someone who has passed away, the patient did not see his physician or his doctor for the past 3 weeks. 2 weeks, sorry. 2 or 3, 2 weeks.
2 weeks, fortnight. 2 weeks,
Yep.
fortnight.
2 weeks. So if a family comes to you and they tell you that our grandfather has been suffering for the past 1 year with a congestive heart failure, and he has been on regular follow-up in the GP's clinic. Did he see his doctor in the past 2 weeks when his condition deteriorated? No, he did not. Suspicious. Coroner. Following, Dr. S. Dr. S. Come
Death
on.
in police custody.
Police custody. Police
Police
custody.
custody.
What?
Death
Okay.
in the police custody or jail, prison, in prison.
Coming to that.
So if the
In
court
any case
court
of road
orders,
traffic accidents or industrial injury, or there is a criminal suspicion, this is automatically coroner, because the coroner will provide us with an official report which will be needed for insurance purposes, whether this is industrial road traffic accident, and definitely criminal is suspicious, so we need an official report. And lastly, someone who has
Excuse me,
passed away
the
in
industrial means occupational.
occupational, yes, or someone who has passed away in institutions like prisons, maybe the police has killed him, or in mental health hospitals or facilities. This is suspicious because those are the places where people should not die suddenly. This is suspicious. This is coroner. So, Dr. S, are you there?
Yes, sir.
What is the difference between my answer and your answer? Simply speaking, it is all about the points.
Yeah,
I
your system.
knew how many points before I started discussion or I started talking. I knew there was 6 points before I speak. Yeah, I'm sure that you know all of them, but the problem is to extract it properly in the time frame given, aka properly recall. So this is how to do it in a proper recall. I hope it's helpful.
Yes.
So this is how to tackle communication, how to write down your paper, how to put the items of the history, if there is any. By the way, if you want to ask about the history here, it's not applicable because the lady has passed away. So there is no social, no past, no medication history. What is the only thing that I can ask about in this case? Can anybody guess? As part of her history.
If anyone is dependent on that patient.
Thank you, ma'am. Allah yaftah عليك. If someone is dependent on the deceased or the patient, this is the only thing that I can ask about in such a case. But asking about her past history is not relevant anymore. خلاص, she's over. De nada. So these are the items that we need to cover. We did checked it, the discussion with the examiner, the usual pitfalls, and the standard questions. So overall, it's a very well done case. Thank you, my friends. Thank you, Dr. S. You have done very well. Hopefully it's easier now for everyone.
Yes.
If anyone has any question here, shoot. And by
Yes,
the way, Ryder is terrible in this case. Don't read it from Ryder. It is terrible in Ryder.
I have a
Yeah.
question about death certificate.
Okay.
Can I convince the patient to go for the examination by telling him that I can issue the certificate, even though he agreed for us to go for the examination?
He will ask you about the certificate whether he agrees or not, because he wants to test your knowledge about being mandatory or optional. Both ways. Whenever it comes to hospital post-mortem, whether he accepts or refuses, you will make sure that you will give him the certificate as soon as you can.
Okay, even though I will go for the examination and he accepted.
Even though he can take the certificate, the patient can't, the next of kin can take the certificate to start the preparation for the funeral while you are doing the test or while you are preparing for the test.
Okay. My other question, if you don't mind.
Sure.
In some scenarios, you gonna do the hospital post-mortem examination because you already questioned the diagnosis. Like for example, if the case was pneumonia, and you were suspicious about the shadow in the. So like the consultant, we're suspecting a kind of a cancer. So when you will do
Okay.
the, he might then tell you that you did not diagnose correctly. My relative, you would
Okay.
offer
This
even a better treatment or something like this.
is a different one, meaning just the provisional diagnosis, right? This provisional diagnosis can be right or wrong, correct
Yes.
or incorrect. Who am I to judge it? I am no one. It depends on the scenario. Meaning, if the patient comes and he underwent investigations, and in the investigations, the team has missed something, this is automatically an error. They have fucked up. Sorry to say that, but this is the proper way. But if they come and they receive all the investigations and treatment according to the protocols, they did not lose anything, they have done everything they possibly can, this is okay, there is no error, and you will proceed to the post-mortem. And usually in the scenario, you can tell, because in the scenario, he will tell you that you need a permission from the next of kin. So it means that there is no error, and this is optional hospital post-mortem. And as long as it does not fulfill the criteria for coroner, it's hospital. I hope this is helpful. I'm sure it is. Any other question, anyone? Thank you for the good questions.
Yes, Dr. Hassan, one question.
Shoot. Shoot
Uh,
two.
Regarding this indication for coronal autopsy,
Mhm.
if we apply this in this case, so the patient was resuscitated and recovery was good. He died within 24 hours. It
No.
was sudden,
He
unexpected, and
was-
unexplained. So
Okay.
there is no need for consent. It should be
That's-
without consent.
That's a good point. However, this is not the truth. How? It was mentioned that she came to the hospital in a bad state. She was dizzy and she was hypovolemic or whatever, unstable, loss of losing consciousness. She was stabilized. On the other hand, your discussion when it comes to that, the lady was not treated because we do not have a diagnosis. If someone comes with a pneumonia, that example, and he was admitted, he was diagnosed and he was treated. He was recovering well, suddenly he passed away. This is coroner. But this lady, she was admitted, stabilized, did not receive any treatment yet because she was still under investigation. Nobody knows what is the nature of that tumor.
No, but you said that it was
Hypoadrenalism. So what are the reasons, or what is your differential diagnosis for hypoadrenalism? Do you have only one differential or hundreds?
No, but there is a mass in the CT. So most probably what you want to know after autopsy, it is malignant or not. If it is malignant,
Thank you.
it stays
So,
the diagnosis will stay the same, hypoaldosteronism.
okay, what if you found that this mass is benign? Is there any guarantee that this is cancer? If there is no guarantee, it means that you do not have any basis to say this is cancer or not. If you know that this is cancer, there is no need to go for postmortem at all. You saw something on the imaging and you're not sure about it, and that's why you're taking a biopsy. But since she passed away, you will take the biopsy after she passed away. Why? To help others and to prevent it from happening again in the future, along with the research. Simple concepts. Not make it complicated for yourself. Regarding that point, I think this is what you're referring to. If someone has passed away during a procedure, or within 24 hours of recovery from a procedure, not from someone was having a heart surgery, passed away during the heart surgery, this is coroner. After the heart surgery, he went for post-surgical ICU. Within 24 hours, he passed away in the ICU. This is also coroner. Following?
Yes, okay.
However, if you have someone who was admitted yesterday after a road traffic accident, not a road traffic accident, let's put it this way up, he was admitted after sustaining a stroke at home. He got a bleeder in his brain and he sustained a stroke. He was admitted. And after 24 hours, he passed away. Is that coroner?
No.
Why? Because you already know that since he came with a stroke. This is something very severe. It was not unexpected, unexplained, or sudden. You already knew that he has an issue. That's the difference. So this is 24 hours after admission death, which is not a coroner. The previous one, 24 hours after the procedure, during the recovery from the procedure, not from admission. This is the misconcept. And you have fixed it, hopefully. Do we agree?
Yes, okay, okay. Thank you. Understand.
Thank you, sir. That's a good one. Okay, that's a lot of talking
Hello.
for today.
Hello,
Thank
doctor.
you.
Just one question.
Shoot.
Yeah. Actually, when they will ask for this certificate, no, we'll give him as soon as possible. But after the procedures, if we need to change anything, so what will say to them or anything like this?
Can you rephrase the question, please?
Yeah. We will give the certificate when they will ask as soon as possible with
Yes.
our provisional, what we are thinking now. Hello?
Yes, you will give them the certificate as soon as you can, whether she
Yes.
asks about it or not. Because
Okay.
you want to show the examiner that you do know what you're talking about.
Yes. But after the postmortem, if we found out something else.
Doesn't have to be
And-
after the postmortem. Again, what would be written in the death certificate if she refuses the postmortem? Cardiovascular collapse. So there is a diagnosis or the cause of death is identified, given in the death certificates. If you identify something further, it is the nature of the mass, not the direct cause of death.
Okay, I understood. Yeah, thank you.
It's very simple
Yes, sir.
if you keep it simple. So yeah, it's discussion so far. So thank you everyone. I'm sharing again the link for the Telegram and the chat.